barriers to access to care for low-income, underserved populations, including those living with chronic illnesses and disabilities. I want to start by thanking everyone for providing me with the opportunity to present to you this morning. It's probably as obvious I'm not from South Carolina, but over the past several years I've had the honor to work closely with both community-based providers and government officials working to address the challenges that many low-income South Carolinians face in accessing care and treatment. Since 2009, my center at Harvard Law School has conducted research and policy analysis to identify successes as well as challenges and opportunities for improving healthcare access. There is much to be said about the strengths of a state like South Carolina that has dealt with differential poverty and insurance issues for a long time. Among other things, the diversity of the illness, disability, provider, workers, small business, and state government representatives here today attest to the ongoing efforts to forge collaboration and consensus in a challenging time. I am well aware of the gains that South Carolina has made, as well as the difficulties you face as a state. The economic downturn has affected the whole nation. Nonetheless, many states have found new opportunities for assuring health care coverage, both through the Affordable Care Act and its improvements, and through state-specific expansion and quality improvement efforts. What we know from looking across this country is that inadequate coverage is not just negatively impacting people's health, it is also costing states money, including here in South Carolina. The good news is that this trend of disinsurance, increased morbidity and mortality, and excess costs associated with care forgone and jobs forsaken can in fact be reversed. Successful implementation of the new healthcare reform law, the Affordable Care Act, can meet the needs of consumers, providers, and government, bringing new resources as well as new opportunities for healthcare and for the state's economy. The Affordable Care Act can help South Carolina to successfully address barriers to individual health care, important public health challenges, and state fiscal stability. This is why the Affordable Care Act is a win-win-win for South Carolina. The groups represented here today, those who work with people who are poor, working people, small business owners, the elderly, and people living with chronic illnesses and disabilities know what a difference full implementation of the Affordable Care Act will mean here in South Carolina. If fully implemented, the overwhelming majority, approximately 75% of those currently uninsured in South Carolina, will have access to subsidized private health insurance or Medicaid. They will have access to free preventive services, as well as early intervention and comprehensive health care. And those who have chronic illnesses and disabilities will be eligible for cost-effective, coordinated health home services. Full implementation of the Affordable Care Act will increase the likelihood that residents get regular testing and care that dramatically improves health outcomes and prevents the onset or progression of many costly diseases. It will reduce the severity of prognosis for those who will have now have access to early treatment, and will reduce preventable high-cost medical interventions and costly hospitalizations. All of these interventions, which will be made possible through Medicaid expansion, to hundreds of thousands of South Carolinians who are currently uninsured, will improve health outcomes, save lives, and save the state from spending on high-cost preventable interventions, costs that taxpayers in South Carolina currently cover for the uninsured seeking care in state and local hospitals and health centers. As to addressing public health, expanded access to care provided through Medicaid expansion will greatly reduce the spread of communicable disease, by providing treatment and a cure for some diseases and reducing infectiousness for others. Now, in addition to individual and public health, the Medicaid expansion, frankly, is a great deal for South Carolina. The federal government funds over 90% of the cost of covering all the newly eligible people. And South Carolina is one of the biggest beneficiaries of this funding, given its disproportionately high rate of people being uninsured in this state. The traditional Medicaid program, the one we already have in every state, is largely not a health care program. It's instead a disability care program, with over 80% of traditional Medicaid expenditures being spent on long-term care and inpatient hospital care. Traditional Medicaid does its job of covering care for our poorest and sickest citizens. The Affordable Care Act's Medicaid expansion, however, is not about disability and long-term care. It is about giving hundreds of thousands of uninsured South Carolinians, including many who are working in or own small businesses, access to high-quality, comprehensive, and affordable care with an emphasis on prevention and early intervention. The Medicaid expansion is a first ever in this country, public, prevention-based, affordable health care program. If fully implemented in South Carolina, it will provide health care coverage to approximately 500,000 people, with the private subsidized health insurance providing care to an additional 250,000 people. Workers who work 40 hours per week, 52 weeks a year, and earn a minimum wage will qualify for Medicaid expansion if they are uninsured, as are many low-wage workers here in South Carolina. Finally, while not perhaps the goal, this primarily federal investment in Medicaid expansion comes with the added benefit of generating tens of billions in economic activity here in South Carolina. For the state's average investment of $250 million a year, which is only focusing on the costs, not the savings that I've identified in individual and public health, the federal government will contribute $2.25 billion a year, over $14 billion in federal expansion funds by 2020, let alone the multiplier effect created by these funds, which will be spent in many sectors of the state's economy. The sad reality is, if South Carolina doesn't expand Medicaid, South Carolinians' federal tax dollars will instead go to provide health care for people in New York and California, states that will implement health care reform and the Medicaid expansion. We must all work together, putting all politics aside, and do what is right for the hard-working people of South Carolina. South Carolina is a great state, and state officials have in the past demonstrated forward movement in securing cost-effective care for some of South Carolina's lowest-income residents. Implementing the Affordable Care Act and its Medicaid expansion would further benefit the state's health and healthcare system in the spirit of these steps already taken. The bottom line is, we can address skyrocketing rates of obesity and diabetes. We can successfully treat many forms of cancer. We can reduce heart attacks. Treatment advances are such that we can dramatically improve public health outcomes. And ultimately, we can provide much-needed health insurance to low-income workers and small business owners in South Carolina who desperately and increasingly need access to affordable health care. The opportunity is here. Hopefully we can all come together to see to it that the time is now to implement the Affordable Care Act and Medicaid expansion here in South Carolina. Thank you.